So what is the definition of nephrotic syndrome and what are the different components of nephrotic syndrome? I am drawing glomerulus here. We have a Bowman's capsule and we have glomerulus, that is the afferent and efferent arterioles. They form a network of capillaries inside the Bowman's capsule and this is known as glomerulus. If you look into the details of it, when the blood is passing through the glomerulus, the blood contains the serum proteins and among them the abundant one is albumin. In a normal kidney with normal functioning of the glomerulus, the albumin will never cross through this arteriole and it is never excreted in the urine because it has some negative charge and it cannot pass through the slits of the glomerulus. This is what happens in a normal glomerulus. In glomerular diseases, that is, if there is any issue with the proper functioning of the glomerulus, the classic examples are minimal change disease, focal segmental glomerulosclerosis, membranous nephropathy, and rapidly proliferating glomerulonephritis. In all these conditions, what happens? Because of the loss of function, now the albumin is, to be more precise, it is proteinuria, but the predominant component is albumin. So proteinuria or albuminuria occurs because of the defect with glomerulus. So nephrotic syndrome has four important components. So it is a clinical complex which includes four important components. When you do urine analysis, you will find massive proteinuria. So we also call it as nephrotic range proteinuria. So if you are doing a urine dipstick test, in the dipstick test, you will see more than 3+ result. Okay, and if you are doing urine analysis for 24 hours, so you are collecting 24-hour urine sample and you are measuring the total protein, it is more than 3.5 grams excreted. So this is what is massive or nephrotic range proteinuria, which is one of the important components of nephrotic syndrome. The second component is because there is loss of the albumin, so the patient will have hypoalbuminemia, that is low levels of albumin in the plasma. So the levels are less than, you need to remember these values, 3 grams per deciliter. So the serum albumin levels are low here. So whenever the serum albumin levels are low, it leads to the development of edema. How the edema develops and all we'll be discussing in the next part of the video. But what you need to remember is the third and important component of the nephrotic syndrome is the development of generalized edema. We also call it as anasarca. But in exams, in questions, in MCQs, they'll mention like this. So the patient will have the pedal edema and also periorbital puffiness, very important, in the initial stages. Later, in severe conditions, you will see the anasarca. But periorbital puffiness development in the early morning is classical of renal disease. Fourth component is hyperlipidemia and lipiduria. Let us discuss why the lipid levels are high and why there is excretion of lipid in the urine. But you need to remember that there are four important components of nephrotic syndrome which defines nephrotic syndrome. So nephrotic syndrome is a glomerular disease. It refers to a clinical complex that includes massive proteinuria or nephrotic range proteinuria, hypoalbuminemia, the levels are less than 3 grams per deciliter, generalized edema, and very important is hyperlipidemia and lipiduria. So all of these four components to be present to call it as nephrotic syndrome. So what exactly happens in nephrotic syndrome? Just let us go through the flow chart here. Because of the low levels of the serum albumin or serum proteins are very important in maintaining the intravascular oncotic pressure. Starling forces, they operate in the body. They operate both in intravascular and extravascular compartments. So what are the components of Starling forces? One is hydrostatic force and the other is oncotic force. oncotic force or oncotic pressure is because of the serum proteins. Because of the low serum proteins, that is loss of proteins in the urine, now there is reduced intravascular oncotic pressure. So because of the reduced oncotic pressure, the fluid from the intravascular compartment, it comes out and there is loss of fluid into the interstitial space. So this loss of fluid into the interstitial space leads to reduction in plasma volume, because plasma volume now comes down. So whenever there is reduction in the plasma volume, so the intravascular capacity is sensed, and because of there is reduced plasma volume, now the kidneys will start acting. And what do? Whenever there is low plasma volume, RAAS, that is renin angiotensin aldosterone system, gets activated. So there is increased aldosterone secretion and decreased renal function. All this leads to salt and water retention, in turn causing edema. So this is the reason for development of edema in nephrotic syndrome. Similarly, because there is low albumin, body starts producing more and more albumin with the help of liver. So now the liver increases the albumin production. Similarly, it also triggers increased lipoprotein synthesis. So whenever lipoproteins are increased, so they increase the levels of lipids, that is increased triglycerides and also LDL, which are actually bad cholesterol, and this leads to hyperlipidemia and excretion of this excess lipids in the urine, and the condition is called lipiduria. So with this part of the discussion, you know what happens in nephrotic syndrome, that is why there is development of edema and why there is development of hyperlipidemia and lipiduria. You need to understand that activation of the RAS leads to salt and water retention. This leads to edema, and similarly increased lipoprotein synthesis by the liver because of the positive feedback mechanism, that is low albumin. Now the liver starts synthesizing so that it can compensate for the albumin. All this leads to hyperlipidemia and lipiduria.